about now. Let's go on with conversations about healthy living, and this is where you're also interested, right? I've got my doctor friend in the building, but this time around, joining us all the way from the US, Dr. Amadin Osayomore, of course, joins us, and we have some very interesting conversation that will interest you and I, especially by popular demand. All right, so let's get to the nitty gritty. I mean, keep someone up at this time. If you understand how the timing works, I think it's about 3:15 a.m. Where he is right now. But he said he doesn't mind anything that makes us happy. He's down for that. So top of the morning to you, Dr. Amadin Osayomore.
Good morning, my awesome friend. It's always a delight to speak with you. Yes, whatever makes my people happy makes me happy.
Thank you very much for staying off to talk to us this morning. Now, we started this conversation some 2 weeks ago, actually, erectile dysfunction. And, it seemed as if, a lot of people got more interested in it. People wanted to hear more about it. And we say, you know what, let's bring it back. And that's what we want to do again. But let's just scratch it at the surface, first of all. What exactly is erectile dysfunction, and why is it becoming quite rampant, or why is it becoming so common among men today?
Well, a simple definition for erectile dysfunction is when a man has difficulty or keeping or getting an erection that is strong enough for sexual activity. And yes, you're right. It's becoming more common than people think, especially as men get older, men over their 40s. And you asked me the common causes, what can cause it, right? It's everyday things that people deal with every day. And you hear them on TV, you hear them on radio, things that are hypertension, diabetes, low testosterone,
right?
And those are just on the medical side of things, okay? The other causes can be psychological.
Okay. Speaking of psychological, doctor, we'll come to that part. But speaking of psychological, it's a little bit of bother because most people don't even talk about it, so they rather suffer in silence. Is there something to be ashamed about when it comes to ED, like you call it, erectile dysfunction? Then we'll now talk about psychological causes. Is it something to be very much ashamed about, or do you think people come out and talk about it well enough, talking about erectile dysfunction?
I don't know if they speak pidgin English in this your show.
Let's go there.
You understand our people now. There's no way that a man will be happy and confident to say such a thing. It's as if your man card, as they call it, a man card, has been taken from you. You have been demanded, essentially. You have been degraded. So yeah, there's stigma, there's shame, there's a sense of unworthiness, inability to be a man. So yes, it can be quite. So people don't want to. Everybody wants to be seen as alpha male, no matter how. So nobody wants the talk that kind of thing come out now, except when they are now desperate.
Right. And now you were going to talk about the psychological causes. Could it be that maybe one is overthinking it, and you are now enlarging the problem in your mind? Could that also be a cause? What are those psychological causes?
Psychological problems are real problems. If you have ever faced anxiety or difficulty, something that causes you fear and worry, you will know they are real problems. So there's nothing like overthinking it. When one facet of a man's life has issues, it can manifest in different areas.
Right.
Stress. As men now, it'll be 3:00 in the morning now. My dad wake up. You have been awake since how many o'clock now?
Right.
We push our mind, we push our bodies. We are under pressure, workload, financial problem, deadlines. You are thinking that before you know what is happening, it is piling up. You are finding you are getting strain headache that cannot make sense, irritability. You can't sleep well. You are getting tired. Before you know what is happening, downstairs don't get wahala. Stress is a big issue. Yeah.
Now, let's
I
now
can
let,
go on though if you want me.
no. Let's we understand. We can't continue to amplify the problem now. We understand this problem exists and it is caused by all of these reasons. There are people facing this real life problem as we speak. Now, doctor, what kind of medical intervention do they have? What kind of real medical treatments do they have for those that are struggling with erectile dysfunction?
Okay, so again, it all depends on problem treatment. When it comes to psychological things, the psychologist can help you and other options.
Right.
But my area where we also can help you with that. But the things that we can do, the medical things that we can and do to help you, the consolation. There's something called Trimix.
Okay.
Is something that can be used. We have what they call platelet enrichment therapy, which we can also provide. But you have to understand that all this is based on the particular cause of the problem.
Oh, I see.
Now, by time, if people get to you earlier, you can begin to deal with your secondary stuff. It helps. But essentially, by the time most of our people that they come out and talk, we're not up as Gary. So by that time, yes, we're still able to help. We can help you with hormone testing, see what's going on with your hormone levels, so we can intervene there. We can help you with the injections I just described for you.
Right.
And we can also help you with strong counseling, diet, and lifestyle.
Right. When it comes to diet and lifestyle, a lot of people think it's something huge entirely, like you want to affect how they live their lives. But you mentioned Trimix, you mentioned this enrichment therapy. How do they really work? How do they help?
That's a very, very good question. How does Trimix help? So just think of blood flow problems, right? Just most of the problems in erectile dysfunction. Remember I was telling you diabetes, hypertension, right?
Right.
It is a blood flow problem because an erection is a blood flow event. People don't realize it. There's a lot of blood flowing and staying there and doing its job. And what we now do is, okay, if there's a blood flow compromise, something's happening and compromising the blood flow, we come in with therapies to help improve your blood flow. These medications, they relax the smooth muscle of the penis, they increase tissue blood flow, they expand the blood vessels by relaxing the muscle walls of the penis, and they will block the signals telling that block signals that cause the blood vessels to constrict.
Right.
All right. So you can maintain a good quality erection. Yeah.
Now,
what it's going to do. Yeah.
Now that's for the Trimix now.
Yes.
How about the enrichment
Yes.
the therapy you talked about as well? How does it help?
So now that is a great therapy that we apply. And if you remember the last time we were talking about your body itself is a healing agent in it.
Right.
Right?
True.
Yeah, okay. Right. So that when you have all those injuries, or you had diabetes, because diabetes and hypertension go mess up your blood flow. That's what they do. They don't do anything else. They just destroy the blood flow. And they destroy the blood flow in different places. It is doing it in your heart, it's doing it in your eyes, it's doing it in your brain. And it is doing it in the headquarters.
Of course.
So when it is doing all that, we now ask ourselves, when you have a blood vessel damage, how do you get healed? Your body has constituents that try to be repairing as the disease is damaging. Natural constituents that the God of heaven has already put there.
Right.
What we do is, okay, what if I can collect those constituents from your blood, concentrate it, instead of you taking it, it's going to different parts of your body, I take it, concentrate it, and send it directly to where you have a problem.
Right.
You see the trick. Now, I think I can speak with English in this
No, you can flow. You could switch as much as you want. No,
yeah. So you find yourself getting tissue regeneration. You're getting improved blood flow. You're getting improved nerve health, just because your body is the area in issue at damage is getting like. direct therapy.
Direct.
Instead of waiting for the body to gather, you just gather it for the body and put it where you have the problem. And we do this not just in the in headquarters. It can be done in your joints too.
Right. Any
so
part.
Just think of
any part of the body at all.
Anywhere where you have, wow. Where you typically, most of the part where you have blood vessel damages.
And you're saying these treatment options are very safe?
Absolutely. You reason it now. I'll give you an analogy. Right. What is the problem with organ transplant? The problem is it's another person's organ. That is why you have wahala. If it was your organ, you will not have problem. So this is your own blood.
Okay.
So we're talking about you are not going to get the problem because your body to your body. Now your body is your own body. Your body does not recognize it as an enemy. It sees this is my guy be this. So it do not react. So that is so and this can be very, very, very painless. In the hand of a skilled practitioner, you will have almost minimal pain because we do a good job, especially you're all numbed up and not very comfortable, very private.
I see.
And now you now even know it.
Now, doctor, I'm looking at it now. You said something about usually those at 40 plus are more susceptible. Are younger ones completely free from issues of ED? And when it comes to these treatment options, is it more difficult, in older men when you're treating them than younger men, or it really doesn't matter the age when you're treating them?
Well, always remember the thing that's causing the ED, unfortunately, age is a gradation, right? The guy who has diabetes today, that was found out today, and the guy who had it for 30 years, not taking care of himself, eating all the shawarma, agreed for the beer parlor.
Don't slander shawarma on this show. They will come for you. Don't slander shawarma.
No. I'm a shawarma man.
I know, right?
I have shawarma in my fridge now. When I wake up now, I take a cold one. I love shawarma. I'm just saying that. I love shawarma people. Why not be angry with me? I'm a shawarma lover. I'm just saying that the person who eats all that with less, we're not. You know how we are at home now. We're not. People they struggle. Person want to live life. So the more the damage, the more therapy you need. So a younger person absolutely can suffer ED. But yes, they might typically depend on what's causing their ED again, because you can see someone who has type 1 diabetes and suffering from ED, as you say, old man, because type 1 diabetes starts when they are very young, right? And the damage can escalate. So and there are other things that can cause it in younger people. As some studies even say that 1 in 4 new ED cases occur in young men under 40.
Wow.
But for most young men, typically, yes, it's a while. But for most young men, it's mostly psychological or lifestyle.
I see.
Because the medical courses have not had time to damage them. It's not impossible, though. Like I told you, type 1 diabetes, obesity, heavy drug use, heavy smoking, lack of exercise, your hormone is all whacked up, hormonal imbalances, chronic blood pressure diabetes that has been going on for 20 years. The guy is 40, 39, but he has had diabetes for the past 19 years. It's not the same thing as a 40-year-old who was just diagnosed yesterday. You know what I mean?
I get you. Now, doctor, let's cut to the chase. We have to go very quickly. But now, at what point should someone seek a professional help? And what makes your own treatment pattern, your own treatment option, your own clinic different from any other one that people might want to approach?
Once you have started noticing, you don't go 1 month, 2 months, anything, I would say anything more than 3 months is an issue. Or you find out you're confident, you don't have confidence again. You don't realize that sexual action for men is like drinking water.
Right.
They tinker. Once light on, action.
Let's go
there.
But
if you don't find out that you are now anxious about light coming on action, that is the time to now start to say, you know what, that we need to go check this out. And you say, why are we better? Well, I don't want to offend. I'll just say that this is something we've been doing for a while.
Right.
We're well trained. People they don't go school where we're talking about we're international providers. Essentially, they train us for us. Now house they for cook us.
For us.
They carry us go outside.
I understand.
Now house they cook us. We can't go outside, go let work. For outside now we come back to us again. That's how we say it. So yeah.
I understand. Now you want to maybe like contact how to get more information. You want to help us with that very quickly?
Oh, absolutely. So we'll say that the name of our facility is Washington. Where the place where we can help you. Just hold on, just a minute, please. Is in Eco. You know the place.
Yeah, in Lagos.
I think you there, and we say you can call us at. Let me try to have the right numbers for +234
Okay.
916-395-532. Okay,
all right.
That's one of our numbers.
You want to take that again?
We also, I'll make I go slow. Okay, let me just take it this way. Let's give you a simple one. 091-639-55392.
Fantastic.
Okay.
Fantastic.
Another number is 081-205-75581.
All right, that's for Washington Prime Medicals.
Washington Prime Medicals, right there, 106 at the Sherry. We can be of help. We can help you.
Fantastic. Thank you so very much, Dr. Amadin Osayomore. But I would love to also talk to you again later on issues of allied interest when it comes to health and making sure we are actually having a healthy living. Thank you for staying up, and please keep that shawarma, keep it very, very, very chilled. Maybe one of these days I'll have mine too when I come around or when you come back.
Absolutely. Go step down. I know. You take care, my brother, as well.
All right, now enjoy the rest of your day. All right, so there you have it, right there. All in the interest of us living healthy. You can also